If we
Mhm.
don't have the terms really solidly defined and you know what you're trying to describe, it's going to be very, very difficult to describe
It's
a complex
That's
pattern.
right. That's
And
right.
ultimately, you're trying to test these patterns and
That's
find out
right.
what's
You
wrong
have
with these
to.
patterns.
That's right. If I had a coach and I needed to explain to him what I was seeing in terms of fixed and mobile points and homologous or heterologous patterns, I have to have a definition that crosses the ether. Otherwise, he'll draw me something grotesque. And that wouldn't be. I go, that's not what I said. He says, well, that's what I understood from your definition. So that's it. So yeah, it's kind of interesting, and it will be something that I think we should revisit and look at, because it really, um, as things get more complex and we try to keep abreast of the language of movement, we cannot have a stumbling block that is going to hamper the efficiency with which we can discuss a movement, and especially with an understanding that we have of fixed mobile points supporting and so on. We have, I think we have an obligation to make sure that we are very clear about where we stand and what it means.
Well, what do in your when you talk about
Oh, sorry,
when you talk,
this.
that's okay. They're finally
Okay.
coming to get you, huh? I
Yeah,
called
that's
while you
right.
were I
Yeah,
called right
I
before
know
we
you
started
did.
speaking.
But I'm
I
going to break this computer over my knee before I leave. So good
know.
luck.
Oh, I copied that computer 6 months ago when you went to the bathroom.
Oh,
I stuck
you
the
have
hard drive
no
in
idea what I've written since then.
there. You're right. You've changed it all by now.
I've changed the whole thing.
That's funny. That's funny. Um,
Yeah.
no, I forgot.
Oh,
Uh,
sorry.
oh no. Um, oh, I was gonna say that when I've hear you talk about and lecture about patterns and mobile points and fixed points, you talk a lot about, you know, you qualify fixed points.
Hmm.
There's kind of like the passive, I put my hand down on the ground.
Hmm.
There's an active support through the hand.
Hmm.
There's
Hmm.
talk a little bit about that for
Oh,
me. How you kind of distinguish some of these
I think
supporting.
fixed points can be defined by three conditions. One is that the joint is in a locked position. The axes of the joints lock, and or you are in um, a full end range position of the joint. It locks it, and therefore it becomes a fixed point. It can't go any further. So, or you have multiple axes that cross each other and block the joint movement, like in the midfoot of the midfoot, the mid tarsal joint. Oblique and longitudinal mid-tarsal joint axes, they lock in supination, they open in pronation. So that's one way. The other is a fixed point by virtue of gravity. The weight of the segment anchors it to the surface, and therefore its weight acts as the anchoring mass, which can then allow force generation to lift or move another segment. That is a passive kind of fixed point, just by its sheer mass and weight. And then you have the third, which is that I actively press the segment into a surface, and thereby I fix it against that surface, and it cannot since it cannot move, it becomes a fixed point, and I can change the leverage to the mobile segment. So those are three conditions under which fixed points occur.
And what do you think about, when we talk about almost like virtual fixed points or fixed points out in space, particularly like upright throwing, for
Yes.
example, that
So
leading arm is the fixed point while the throwing
yes,
arm is the mobile point. How is, obviously it is different than
it
actually
is
having your hand on
different.
it.
I surmise that the virtual fixed point is a buttressing
That's the word. That's the
counterweight.
word.
It is a buttressing counterweight. By stiffening the limb, I aggregate its mass into a heavier leveraging weight, and that cumulative mass then has the power to buttress the phasic um, limbs and
Hmm.
add stiffening to the area that is going to have to anchor. So I think that buttressing is something that Suzanne Klein Vogelbach had
You spell that for me?
defined. It will take all the hour to spell it. But Suzanne Klein Klein
Jenkins. Her
Vogelbach
last name is
was a movement. She really did a great amount of movement analysis, and really was ahead of her time in this area of functional movement. And she published several books about it, which I tried to acquire as many of them as I could because I was fascinated. It moved away from the single lever bicep curl concept
Mm.
of movement to the rolling, tumbling. She had names like the policeman, the walking policeman or something. And she had the lizard and all these terminologies for different movements. And she really described fixed and mobile points in the same way that we understand them in DNS, but without really so much about the direction of muscle pull. But she had a basic understanding. It was not so clearly defined, but she really did a lot of work for that. And I was grateful because it opened my eyes to
Interesting.
this a long time ago, but I, at that time, did not know how to use it. It was just an interesting concept. But when
Right.
DNS came along, then it unlocked the information in such a way that I could unpack it. And I went back to these books to look at them. And I still have them and to look at them from time to time. But so this buttressing function is really important. That is how we create a lot of inertia, which can counterbalance phasic movement and keep us safe without having to activate or overactivate muscles. Yeah.
Yeah.
So, and by virtue of that, a mobile point is exactly the opposite of those definitions, in that an unlocking of joint axis can create a mobile point. The moving of a limb passively becomes a mobile point, and then when a limb leaves a fixed point, when it weighs less than what it would have weighed at rest, it is automatically a mobile segment, even if it hasn't moved from that spot, because it is now in activity, even if it hasn't
You
moved.
mean like when it's becoming unloaded?
Yes, as soon as the limb weighs less than
That's
what
yeah.
it would normally weigh at rest on that surface, it is a mobile point because it is no longer supporting. It just hasn't been lifted off the surface.
And
Yeah,
that's how we think about some of the prone positions and things like that,
that's
where
right.
the limb is obviously on the ground, but it
It's
is
resting.
about
Yeah,
to be yeah, it's
that's
about to be
right.
lifted.
That's
It's
right.
not
So
actively
those,
loaded. And
yeah,
I like this idea of it either weighs more, it weighs less.
That's right. So it becomes
As soon
fixed
as
when
it
it
starts to weigh
weighs
less,
more than yes. When the pressure is greater than its own weight, it is a fixed point.
yeah.
Yeah.
Okay.
Yes. So I think when you have these definitions, it makes it easier for you to understand what it is we are testing, what you are describing for the patient to understand, and makes the analysis more elegant and precise. Yeah.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.